Some causes of hip pain are much more common at one age than at another. So, for instance, a condition called Perthes disease usually affects children aged 4 to 11, and often the main symptom is limping, whereas a condition called slipped upper femoral epiphysis often affects children aged 11 to 13. They can get pain in the hip or in the knee or both, as well as limping. At the other end of the age spectrum, in an older, more frail person, a fairly minor fall can result in a broken hip. So if somebody older has fallen and can't weight bear at all, don't assume that they haven't broken their hip. But the most common cause of hip pain is probably osteoarthritis, which we used to call wear and tear arthritis. We now call it wear and repair because we know that your bone is constantly being broken down and reforming itself, and that process goes a bit wrong in osteoarthritis. The pain of osteoarthritis classically goes to the groin and tends to be made better by resting, and worse when you exercise. There's also a condition called greater trochanteric pain syndrome. That's most common in middle-aged women, and that tends to affect the outside rather than the groin side of the hip. There are other conditions, other kinds of arthritis, such as rheumatoid arthritis, which can also cause hip pain. But rheumatoid arthritis much more commonly affects other joints, so hip pain as the main symptom is relatively rare. With most forms of hip pain in adults, a combination of rest and anti-inflammatory tablets will relieve your symptoms, at least in the short term. In the longer term, keeping really fit and exercising regularly, which may seem odd if moving your hip makes it worse, but really regular exercise is essential for reducing the chance of your osteoarthritis progressing.